As the opioid epidemic sweeps the nation, teachers and school staff may find themselves dealing with its aftereffects. But as with many crisis scenarios, the things you've heard or assumed about opioids might not be accurate. In this video, we'll spend some time debunking several common myths and misunderstandings surrounding the opioid crisis, and we'll give you the facts about the origins of the epidemic and its impact. So let's kick things off with a pop quiz. True or false? The opioid crisis started with illicit sales of heroin. False. For many, the term opioid is synonymous with heroin, but the origins of the crisis aren't on the streets. Instead, the overprescription of opioid pain medication has played a large role. In the mid-1990s, doctors began prescribing opioids for many types of pain and other health concerns for multiple reasons, including greater patient expectations for pain relief, multiple muscular and skeletal disorders of an aging population, high rates of obesity, increased survivorship after injury and cancer, and increasing frequency and complexity of pain identification. It's important to note that in 2001, the Joint Commission, which is an independent not-for-profit organization that accredits and certifies nearly 21,000 healthcare organizations in the U.S., created a standard that required all accredited organizations to assess pain in all patients. From 1999 to 2015, opioid prescriptions more than tripled. By 2016, the U.S. was far and away the largest consumer of opioids per capita in the world. Recent data shows 72,000 Pennsylvania doctors writing 4.6 million prescriptions for oxycodone and hydrocodone in just 1 year. That's 448 million dosage units. In other words, about 35 pills for every single Pennsylvanian. According to an article found in the Journal of the American Medical Association, approximately 75% of people entering treatment for opioid use disorder in 2014 started with prescription drugs. And unlike heroin, over 53% of misused painkillers are accessed through friends or relatives, with another 35% being prescribed by one doctor. The 2017 Pennsylvania Youth Survey contains similar findings of youth who reported obtaining non-prescribed medications from friends or relatives. So contrary to the belief of many, the source of the opioid crisis can be traced not to heroin purchased in dark alleys, but rather to prescription opioids from our own medicine cabinets. True or false? Addiction is a moral failure. False. While it might be convenient to blame addiction on a simple character flaw, the truth is that addiction of any kind is a complicated disorder, and opioid addiction in particular is one of the most complex forms of addiction. Opioids and other drugs increase the amount of dopamine in the brain, causing intense feelings of pleasure. This drives users to seek out the drug again and again and makes users psychologically and physically dependent on opioids very quickly. Addiction is driven by genetics, environmental factors such as lack of economic opportunity, poor working conditions, and eroded social capital, developmental factors like family history, trauma, or changes to the brain, and psychological and personality factors like having feelings of hopelessness and despair, distress tolerance, and emotion regulation. Thinking of addiction as a moral failure overlooks the far more complex set of factors that we must confront in order to address the opioid crisis effectively. The natural progression of opioid use disorder is that you begin using to feel good, then you need more to feel normal, and then you have to use to keep from getting sick. You will hear many who have a substance use disorder say, when you can stop, you don't want to, and when you want to stop, you can't. True or false? No one I know is at risk for a substance use disorder. False. Given the stigma surrounding addiction, many of us would prefer to think that it doesn't affect anyone that we know. But the truth is, opioid addiction doesn't discriminate according to race, gender, or socioeconomic background. According to the Centers for Disease Control and Prevention, the growth of the epidemic from 2002 to 2013 showed overall heroin use and overdose death rates climbed dramatically, with a staggering 286% increase in overdose death per 100,000 people. And, as this infographic shows, heroin use increased dramatically among most demographic categories, most notably with non-Hispanic white ethnicities ages 18 to 25, where use more than doubled. It's important to remember that each of your students has the potential to be experiencing some effect of this epidemic, either directly or indirectly through a friend or family member. True or false? Drug overdoses don't cause that many deaths in the U.S. False. According to the Centers for Disease Control and Prevention, in 2016, drug overdose was the leading cause of death of Americans under age 50, with more than 64,000 lives lost. That's a 22% rise from just a year before and more than 3 times the rate in 1999. Due to many of the reasons mentioned before, Pennsylvania is among the worst in the nation in overdose deaths. In 2015, the national death rate was 16.3 per 100,000 residents in the U.S., but the Pennsylvania overdose death rate was 26.3 per 100,000 Pennsylvania residents, and it rose to a staggering 36.6 overdose deaths per 100,000 the following year. And these increases have been sharpest in rural counties. 2016 data showed that approximately 46 people died every day from overdoses involving prescription opioids. The chart seen here shows that states with highest overdose rates from 2010 to 2016. As you can see, Pennsylvania increased from slightly over 15 deaths per 100,000 residents in 2010 to almost 38 deaths per 100,000 residents in 2016. Some good news is that according to the 2017 Pennsylvania Youth Survey, less than 1% of 12th grade students have used heroin in their lifetime, and even less use on a 30-day basis. To learn more about what Pennsylvania youth are saying about drugs and alcohol, visit the Pennsylvania Youth Survey website shown here. Remember, it pays to ask and it pays to know. So, how did you do on your true-false quiz? We hope this information helps you to better understand the opioid epidemic and dispel some of the myths you may have heard. Let's recap the main points covered in this video. First, the opioid crisis has its roots in prescription drug use and abuse. Second, instead of categorizing it as a moral failing, it's important to recognize addiction as a complex disease with genetic, environmental, developmental, and psychological factors. Third, the opioid crisis doesn't discriminate. It affects rich and poor, urban and rural, young and old. And very likely it's affecting some of the students you work with every day. And finally, the opioid crisis is unfortunately a legitimate crisis, and especially so here in Pennsylvania.